Hello, I'm Melanie Moss. May is National Stroke Awareness Month, and we want you to know the warning signs of a stroke. Stroke is the leading cause of death in the United States, killing nearly 130,000 Americans each year. That's 1 of every 18 deaths.
A stroke is when a part of the brain suddenly stops functioning, and this could happen because a blood clot blocks a blood vessel supplying a part of the brain, or because a blood vessel ruptures, causing bleeding into the brain. Common conditions that increase your risk for stroke include high blood pressure, diabetes, high cholesterol, cigarette smoking, the use of illicit drugs such as cocaine, and heart conditions like heart failure or an irregular heartbeat called atrial fibrillation. As compared to Caucasians, African Americans are at a much higher risk for stroke. A simple way to remember the warning signs of a stroke is the acronym FAST. F stands for facial droop, A stands for weakness of the arm, S stands for slurred speech or difficulty bringing out words, and T stands for time. If your loved one develops any of the symptoms suddenly, time is of the essence and you must call 911. Stroke is the leading cause of disability in the United States. The key is that as soon as you develop the signs and symptoms of the stroke, you have to rush to the emergency room. Within the first 4.5 hours, we can offer an intravenous medication called TPA to your loved one, which has been shown in clinical studies to increase the chances of your loved one becoming independent in the long run. In a special group of patients, we can even offer certain procedures such as introducing wires or instruments into the blood vessels of the brain to try to pull out the clot. Be aware of your medical history if you want to avoid a stroke. You should go to your doctor for regular checkups. If you have high blood pressure, diabetes, high cholesterol, you need to be compliant with your medications and take them as instructed to make sure that these conditions are under control. Eating a healthy diet is essential. Fruits and vegetables should be in your diet. You should avoid fried foods and use baked options. And finally, and very essential, stop cigarette smoking, avoid illicit drug use such as cocaine. You should talk with your primary care physician if you need resources in order to help you stop smoking. Sinai-Grace Hospital has stroke specialists available 24/7. For evaluation of patients with stroke-like symptoms, either at the bedside or through an audio-video connection, so that they can be administered TPA in a timely manner. Sinai-Grace also has a state-of-the-art facility for performing angiograms and pulling out clots from the brains of people in a select group of stroke patients. Finally, Sinai-Grace has a rehabilitation facility associated with a stroke unit, which is run by the Rehabilitation Institute of Michigan to provide a complete range of rehabilitation facilities. After you're discharged from the hospital, Sinai-Grace also offers a comprehensive outpatient stroke program where a stroke specialist will evaluate your case, determine why you had the stroke, and make sure that you're on all the right treatments to prevent another stroke from coming on. If you or a member of your family has had a stroke, Sinai-Grace Hospital is where you want to be. You're in good hands.